Andy, on your screen, if you click the record button now that you're host as well, if that's okay.
Yeah, no problem. Yeah.
Perfect. Okay, great.
Good morning, everybody, and welcome to this VerseOne webinar. My name's Graham Page. I'm Managing Director of VerseOne. I'm delighted to introduce Andrew Foster, who is the Digital and External Communications Lead at the Northamptonshire Healthcare NHS Foundation Trust. And Andrew is going to give you a short presentation on how digital has helped them to achieve an outstanding CQC rating. So, Andrew, I will pass straight over to you.
Thank you very much, and thank you everyone for joining me this morning. I'm hoping this morning to talk to you about some of the functionality that we have implemented, which I believe has helped drive positive change in the organisation. And if you've got any questions as we go through, please do pop them into the chat, and at the end I'll hopefully go through a few of those and answer any questions you do have. I think what I want to say right up front is I think there's sometimes a perception that an outstanding organisation must have everything about it all together. What I would say is we're not perfect, we're still learning. This has been a journey for us, and we're still on that journey and we're still adapting. So why I'm going to show you this morning some things that work for us. They might not be right for you, and it really comes down to your audience, their needs, and what you need to communicate. So just to get started, so who are we? You may never have heard of Northamptonshire Healthcare, and I wouldn't blame you, because even we struggle with our local community understanding who we are at times. But we are a mental health, learning disabilities, community health and trust, and we also do things like prison healthcare as well. So we're predominantly in the county of Northamptonshire, although we do have sites outside the county as well. And I'm not going to read through all these stats on this screen, but we have about 4,200 members of staff, and we're covering quite a wide community. And as I said, it's all about your audience, and for us, we're a trust that always wants to learn from our service users and from our staff. So we believe in an environment of co-production, involvement, staff development and learning. And what was really important when we were developing our digital channels is that we ensured we were involving people who were using the platforms and would be using the platforms from the start, so they serve their audience's need and not just what we thought their needs might be. I'm just going to show you this slide now, and this is a really important picture diagram for us. And this is our 5, 4, 3, 2, 1 roadmap, and it kind of shows what we stand for. And it brings together our pride values, our leadership behaviours, our directorates, our enablers, which includes our trust strategies and operational plan, and our mission. And this was important for us throughout our process of becoming CQC Outstanding as part of our consistent messaging, so that everyone knew our values and behaviours, or at least could really easily remember where to go and find them. And this visual has been used across digital comms and offline comms as well, to ensure it's embedded and it could be really easily referred to. I'm just showing you this now because you'll see it come up a few times as I go through these slides. In terms of our CQC, we've been on a journey, as I said, and I know that sounds cliched, but we were first rated in 2015 as requires improvement. We were then re-inspected in 2017 and rated good. And then last year we were inspected again and rated outstanding. So as you can see, this was quite a quick time frame to move from requires improvement to outstanding. And for us, it was using tools to enable our staff to shine, because we knew there was some really good, outstanding care going on in the trust, but people needed that opportunity to showcase what they were doing and show what they were doing. And our digital platforms followed a similar journey. So in 2016, we launched our new Trust Intranet, and this was followed 6 months later by our new website. And I will just say at this point, launching a new Trust website 6 months after launching an intranet is not the best idea. So if you, if you do have more time to do it, I would not recommend doing those two so close together. But we were trying to meet our next CQC inspection and wanted to get our platforms moving forward. So to touch on our digital upgrade project, We went from a platform when we had multiple CMSs. So we had one off for the intranet. Let me just try and mute that other microphone that's causing a bit of interference. Dan, is that all your office making noise?
No, I'm not sure. If you go to participants, if you need to mute anyone, you can.
Thank you. Sorry, everyone. Okay, sorry about that. So yes, as I was saying, we went from a solution where we had one CMS for the intranet, another CMS for the website, another CMS for each microsite. So it's very disjointed, and from a governance perspective of ensuring we've only got one version of, say, a policy, this system wasn't serving it. We also had issues such as the intranet. We wouldn't be able to access the admin portal for weeks on end. It literally just would lock you out and you couldn't get in, and that was that. So that needed to change. So instead, we worked with VerseOne to develop a system where we've only got one CMS that hosts every site off the back of that. And interestingly for us right now, that is only a website and an intranet. So all the microsites that we had before, once we sat down and spoke with our services, we realized we could serve their needs through the main website, and they were perfectly happy for that to be the case. As I mentioned, co-production is very important. So everything we did with the websites and the intranets were tested by staff, by service users, by carers before they went live. And we sat down with them right at the design stage and said, what do you need? What do you want? When you come to our sites, what are you looking for? And then once they were ready to launch, about a week before go live, we sat down with the same group and said, here they are, here's a list of questions, test them, see if you can find the information you were looking for. And from that, we could make a few adaptations, but generally people said the sites were much better. If I click on. So this was our website as it was before. As you can see, it was a treat for the eyes. And this is our site now. So one of the things that service users said to us is actually what they wanted the site to be was clean and simple and easy to find information. I fortunately don't have a picture of the old intranet to show you here, but this is the new intranet, which was used a very similar format to the website, but we introduced a bit more of the brand because that was important to us to get across to the staff the brand we had as a trust. So before I go into some of the functionalities, I just wanted to say that digital communications is obviously not going to be the reason you get CQC Outstanding, but it can help add to the overall picture. It can help by ensuring consistent messaging. It can help contribute to certain criteria, and it can enhance your service offering. And what I would say is it's really important to know the story you want to tell about your trust and find every opportunity to do so. And digital communications can be one of those opportunities. Where we started, and some of this hopefully would seem obvious, but we started by getting our basics right. So there was no point in doing anything more, I would say, expansive, more pretty even. We needed to get the information right, and we needed to get those basics right. So one of the first things we ensured was that we had a logical structure. So we organized information on both sites to ensure information was easy to find. And this was with service users or staff in mind, but also it's important to reflect that the CQC will be looking at your sites before they come to inspect you. So if they can't find what your trust is about or the certain information they'll be looking for on sites, that's not going to set a great first impression. But if you can give them a sense of who you are before they've even walked through your doors and a sense of what you're doing really well, that can actually set a better tone for when they come to you. We use things like a mega menu to make pages visible at a glance. And what we also tended to do was try and fit content onto existing pages instead of adding lots of new pages every time there's a new campaign, a new focus, a new project. Because what we found on our old intranet and website is these pages were liable to come out of date. There would be a project manager maybe in for 6 months to look after a project, they would leave, and then no one will be updating this page. So actually we ask people to take ownership of campaigns and information. So on our intranet, every non-clinical team has their own page. If they want to run a campaign, or there's a new focus or a new guidance, they host it within their page, and then we use things like a blog to promote where the people can find information. And then that team has control over their own page to update their page to truly reflect the information they want to share. So it's much more about teams owning their own areas. For documents, as I mentioned, we used a single CMS. So there is only ever one version of, say, a policy or a procedure. And then we've added a review process to it. So when any document, whether it's a policy down to a poster, hits that review date, we get a trigger. So we know there's information that's going to go out of date. And then we can contact the relevant team and say, have you seen this? Is this still right? Are you updating this? And if they're not, you'll see on this slide there's buttons like expired and archived. So if they don't review this document, eventually it will archive and come off the system. So people aren't accessing out-of-date information. And that was really important for us to make sure that we are safe and the clinical guidance was right. We also made sure that every single service line had at least basic information on the website before we launched. And by basic information, I mean that everyone had a little bit of an overview, a little bit about who the service is for, that there was a telephone number on there for them, and that if they had locations, that they had given us their address details so we could use Google Map integration so people can find our clinics, because we operate from over 100 sites across the county. So actually we want people to be able to find them easily. So we've got the Google Map integration with the directions plugged into the site, so people can go on there, put in their postcode and find their way. And again, this is obviously with service users in mind, but if you're a CQC inspector trying to find these locations, we could say to them right at the beginning of the week, you can find all our sites on our website. So if you get stuck, go on there, get directions. And it was also important for us that every service line was on the website from the start, so people knew the breadth of our services, so they could find basic information. They weren't relying on speaking to someone else to find out our information, or relying on a website such as NHS Choices, which we know can go out of date, and especially for us when we're sharing sites with different NHS trusts, it might not reflect us as a trust, so we needed to make sure our website was right. And then the other thing I would say on getting your basics right is ensure you've got consistent messaging throughout your platforms tailored for the different audiences. So we want to make sure what we're saying to the staff through the intranet is very similar to what we're saying for the public website. So when the CQC look at the public website and then they speak to the staff, they're not being told two different messages. An example I've got on the screen here is on the left, we've got the 54321 roadmap page from our intranet, which focuses on that internal campaign about who we are and includes things like our strategy. And on the right, we've got our strategy page from our website, and that's using terms like strategy more because that's what the CQC would be looking for, what other partners would be looking for. They wouldn't know about 54321. So tailoring that language, but actually giving the same message around our strategy, around our vision and our values. And then I'll just mention, obviously both sites were mobile optimized. They included foreign language translation, accessibility tools, etc. Any standard that you would expect from a website these days, it's important that your sites reflect that, because there's no point doing something really great for, say, CAMs and then it not working on mobiles, because you're losing the audience that will want to access it in that way. The next thing I would say is know the CQC. So one thing we did as a team is we looked through the guidance on the CQC and each of the areas of inspection, and we went down each part to go, okay, where can we add value as a team? Where can we be sharing information or bringing information together to help the organisation reach where it wants to get to? And digitally, we focused on a few different areas. So we focused on the safety domain, and we developed this area called the Learning Lesson Zone. And this was actually a relatively simple area to put together, but what it does is it brings together learning from across the trust and beyond into one area. So the central bit that says tips, advice and compliments from NHFT was a feed from different blogs. So there were blog articles we already had sitting on different blogs, and we brought it together into that single feed. We had a feed of information from NHSI with the patient safety alerts and resources. Further down the page, we also brought NHSI videos into it, and we brought papers from different meetings like the Emergency Management Committee, which was sitting elsewhere on the site, but we could bring them onto this page as well, still only one version of the document, but displaying on this page as well, so that people knew where to go and find information and where they could read up on what else is happening in the trust, so they can ensure that they learn lessons in their own area. And our director of nursing used this to demonstrate the learning journey we were on when the CQC came in, and this area was actually directly referenced in the report and the summary report as well. We also looked at the well-led domains. So one of our deputy directors, Jean, says she would like to be able to have staff anywhere in the trust easily ask her questions and for her to provide an answer. So we developed this area called Ask Jean, and on it was simply a form, and the form results went straight to Jean, and then Jean posted on the blog the response. And it was really simple, but actually it's quite a powerful tool because it's giving staff a different opportunity to connect with a senior leader. And some of the questions we get are quite in-depth, and others are as simple as, how do I change my vehicle for my mileage claim? Which is quite a simple question to ask. But for a community nurse, for instance, who's worrying about her mileage, this could be really important and actually sends a positive message that Jean, as their deputy director, is interested and does want to help and support and develop her team. For our Freedom to Speak Up Guardian, we developed a page for them, so people could quickly find information about the Guardian, and on there is again a simple form, so people can send anonymous information to the Guardian. And we put a button that's on the side of the screen that says F2SU, and that button sits on the side of every single page on the intranet. So if someone has something that's concerning them, that they can quickly and easily find the Guardian. And again, it's demonstrating our open culture and our safety culture. And we also wanted to demonstrate more about our culture. So we had a page around our 54321, and it's all about living our mission and vision. We had a page on our Let's Talk plan, which is our staff engagement plan, highlighting how we are working with a trust and trying to move on that staff engagement piece. I'm sure most trusts have some form of staff awards. Ours are our quality awards, which we see in the bottom right-hand corner. But through that, we want to demonstrate best practice in the trust, what is the really positive things colleagues are doing, and sharing that learning. And then the other thing we introduced on the top right is this is a Making a Difference forum. And basically this is about thanking a colleague. And this was something our chief executives turned around to me a week before intranet launch and said, I want somewhere that people can say thank you, that they can actually take that time to reach out to a colleague and saying, you really helped me there. And we very quickly put together a forum and we put it out live. And we did minimal promotion on it, but actually out of the whole of the intranet, that is the part that's taken off. And that is the part that people really engage with. So since we launched, we've had 865 thank yous on that forum. And they can be from simple as, thank you for just sitting down and giving me a cup of tea today, that really helped, to this really important tender, you've really made a difference with winning that tender. So it's kind of, it can be as big or as small as people want, and we don't put any restrictions. We've turned off moderation, so people can just post up their thank yous and share them with colleagues, and actually that's such a positive space, and it again just contributes to the positive culture we've been trying to create. So that's a few bits on our that I think have helped contribute to our CQC journey, and they're just a few examples. We've then also worked with our services to find out what they need and what is on their journey for developing as a service, and to see how we can play a role in improving their processes and what they're doing. So to give you a couple of examples, we've been rolling electronic referral forms out across the trust. And the original form was with this one, and it was a referral form for all of our children's specialist services. So it's a single referral form that went into the referral management centre, but it was for anything from CAMS to children's physiotherapy. And since launching this form 22 months ago, we have had 16,470 completed professional referral forms. And this is from a wide range of professionals, from teachers to people in the acute trust to charity sector partners. And this has completely changed that process. And actually it's made it a much more efficient process for the referrer. So rather than having to do multiple referrals to multiple teams in multiple ways, there's one form that they can access through our website and make that referral. And we've since rolled this out into other areas. So for our Changing Minds IAP service, we've got a self-referral. So if someone's worried about common mental health conditions such as depression or anxiety, rather than having to contact their GP first, they can come onto our website, complete the form, it goes straight to the team, and the team will call them back and arrange their first appointment. So it's a really simple way for people to come into our services. For CAMS, they wanted a solution to provide early identification, assessment, and interventions for young people needing help and support. So we did this by rolling out a live chat functionality. And with this live chat functionality, it was clinically safety tested. We trained dedicated clinicians in our referral management centre to use it. And then basically there's a clinician manning it, and it's there. So if a young person is concerned, or their parents, they can come onto the live chat. But it's predominantly there to help signpost that young person to the appropriate service, or signpost to another service or agency. It's not there to provide a diagnostic tool. But actually what we find is a lot of young people might not meet the CAMS threshold, because I'm sure it's the same in many places in the country. There's quite a high threshold for CAMS. But we know there's so many agencies in the county supporting people. So actually the young person can come on here and they can speak to the clinician, and the clinician can say, okay, I really think you should contact this agency. We can also do a facilitated self-referral for it. So if through the conversation, the clinician is going, yes, they do actually meet our threshold, they will help the young person complete a form to then refer into CAMS, so they get support quicker than they would if they're waiting to go through their GP. And they probably have on average about 16 to 20 conversations per month, and the majority of those are signposted to other services. But we think that's great, because actually we're adding value and we're helping prevent mental health illnesses getting worse. So yeah, a really positive preventative service, that. And then for some sites, such as our Serenity Sexual Self-Referral Centre, we've had to take a slightly different approach. So they used to have a microsite, and they did need a slight brand tweak due to the nature of the service. So one of the things that was important for them is not having the visible NHS logo when they go on there, so people feel this is a safe organisation for them to approach. So when we started to break it down what they actually needed, there wasn't actually much more information than what we could host through a page on our site. So instead we looked at changing some of the brand, changing the logos, switching off things like the mega menus and menus to other pages, switching off the site search. And then what we did is we purchased a vanity URL through GoDaddy and pointed it at the site. And instantly you've got a page which for all intents and purposes looks like it could be its own site. But if you were then going in for our main site, you would still find this page through the site search, you would still find it through the A to Z. So you bring the benefits of that with this slight stance of a microsite without purchasing some microsite when they didn't actually need one. So that was a really positive page, and we've since then replicated this approach with a few of our other services, and we're looking at who else might need something like this. One thing for us, and that's just some of the highlights of our digital platforms, but one thing for us is it will never be finished. So we're always looking at what we can do next. So we're currently exploring the use of forums. So we've seen how well it worked with Finger Colleague, and we're now looking to see how we can use them to gather more of our internal comms information currently people send us through articles that we upload to the blog and then do a weekly email, but we're actually looking to see how we can flip that and make people want to self-post on the forum, and then we will extract and curate information from that to share through other channels. As part of that, we're looking at potentially podcasts to help enable our community staff listen to information while they on their visits, not on their visits, while they drive to their visits, as opposed to expecting someone to sit down at a computer and read information when we know that not everyone has time to do that. We're also looking at enhancing our landing pages for our children's services. So for CAMS, having a very clear landing page which shows it's for CAMS and has information that is written for young people, as well as specific information for professionals and the parents/carers. And we've also recently brought a triage tool, which is on this page, which we're using various areas, including on the Freedom to Speak Up page, so that staff can self-triage to find the person, organisation they would be comfortable to speak up to. Because we know not everyone will want to take that first step and pick up a phone, but actually through this they can filter down and go, actually I don't want to speak to my line manager, might speak to a senior manager, actually I don't want to speak to a senior manager, and they can find the person they'd be comfortable to speak to. Outside of digital comms, I just wanted to share a few examples of what else we did to help with the CQC inspection. So one of the things that we try to do is help our staff understand the process. So we produce various material, including this roadmap, which shows the CQC inspection. And alongside that, we developed this Your Opportunity to Shine booklet, which is again a guide to the CQC inspection, because we wanted our team to be really comfortable when the inspectors came in, so they knew what to expect, knew how it was going to work, so there was no surprises for them. We wanted to give them support, ensuring they could shine. So this is one of the things we did. This was an A1 poster that went round to every team, and on it had some examples of what we were doing as a trust, which contributed to each of the domain. And then there was space for teams to write on themselves what they thought they were doing as a team, so they could have those conversations in their team meetings to go, okay, actually we're really good at that, and we're really good at that, and then putting it down on a bit of paper, so then when these CQC inspectors came in, they could refer back to it. And then alongside that, we had a CQC areas of focus booklet, which again went through each of the 5 areas, and again teased out some of those bits of information, those nuggets that they could be sharing with inspectors that maybe they hadn't been in the past. And then we also gave them materials to refer back to. So this is just one example of a lanyard card that we sent out for every single member of staff. And on one side, it had that 5, 4, 3, 2, 1 roadmap of the values, the behaviours, the directives, the enablers, and the mission. And on the other side, it had the contact details for the Freedom to Speak Up Guardian. So again, if they were asked by a CQ inspector, so what's your values? They could say, I don't know them, but they're here on my card and I can read them. Or how do you contact the Freedom to Speak Up Guardian? They could literally point at it and go, oh, we call that number, or I would go on that staff room page. And these are just a few examples of the materials we produce, because I think it's really important to have your teams really thinking about why they're brilliant or why they're excellent. Because a lot of teams are, but they just need that help to tell their own story, because to them, it's just what they do day in, day out. They might not realise that actually what they're doing is outstanding. So 3 comms tips for the CQC, and I promise you that I'm on my last couple of slides. So my 3 comms tips would be to be consistent. So in both your messaging, both digitally and offline, and use consistent brands and campaigns to draw that information together. Next thing I would say is make it obvious. Make your key information and areas you want them to focus on obvious across your platforms. So if there's something you know you're really doing really good and great, put them front and center of your websites, and when they're looking at your sites, and put it out on your social media, because they will look at your social media as well. So put it there and make it obvious so they already know about it and they already want to ask about it when they come and see you. And I would also say every trust is unique. So make sure you're telling your story. Show the CQC who you are and what you're about, and make sure everyone from everyone from director downwards is telling the same story and is using the opportunity to shine. So one of our services went from requires improvement in 2017 to outstanding in 2018. And when you speak to the service manager, she says that they didn't do anything fundamentally different. They just got better at recording their information and then telling their story. They learned how to celebrate what they were doing and tell the CQC inspector, and not being shy about it, being quite forthright and saying, this is what we're doing and this is why we're outstanding. And one thing we did do is we developed a film that we showed the inspectors on the first meeting when they came in to see us. And this film featured staff from across the trust from different services, and it kind of showed who we were, and it really did set the tone for the rest of the visit. And we actually had some CQC inspectors in the room who were quite emotional after watching the film. So again, you're not going to get CQC outstanding on the basis of a film, but something like that that can give them a picture of who you are and what you're about, I would really recommend, because it did make an impact for us. And if you're interested, it's on YouTube. Search #WeAreNHFT and it should come up. But yeah, I would recommend something like that. And then finally, this is a slide our chief executive shares. And she believes these are the 6 reasons we achieved outstanding. And she would explain it much more articulate than I will. But she said it was our focus on developing a strong and positive culture. It was a focus on leadership, and for us that means devolved leadership. So everyone of every level being a leader, and that was through our leadership behaviours. The focus on consistent messaging, and that's something I've come back to a few times, but everyone sing off the same hymn sheet, having that same messaging. It's a ward-to-board approach, a bottom-up approach to developing solutions and services rather than a board imposing change. So we are actively encouraging our trust to come up with ideas, to challenge, to have conversations, to enable. It's everyone knowing their actions, everyone knowing what they're supposed to be doing and doing it. And that sounds really obvious and simple, but if you've got someone that's standing there going, I don't really know what my role is, what my job is, they're not contributing towards a positive trust. So actually, yeah, everyone knowing what they're supposed to be doing and doing it. And then, as I've just reflected on, remembering to shine and making sure we use every opportunity to tell the CQC and others our story. So that's all my slides. I just want to say thank you again for listening. I'm going to see if I can get the chat up. So if you've got any questions, I will go through those. Or if you think about something afterwards, that's my Twitter handle on there and my email address, so please do get in touch. And I can see I've had one question come through. Is the document module you use for policies a VerseOne product? So yeah, that was the standard document functionality that comes with VerseOne. So if you're using VerseOne CMS, you would get that as standard. Just seeing if anyone else has got any other questions. Take that as a no.
So this is Graham again. So Andy, I'd like to say first of all, thank you for such an excellent presentation. It was great.
Pleasure.
And secondly, well done to you and your team for what you've achieved.
Thank you.
It looked fantastic. If you could do one thing, if you could just stop the recording your end, that would be great.
Yeah, let me just. Oh. Let me just see if I can find it.